Community Health Worker Training, Cardiovascular Health and Diabetes. Module 2 addresses heart attacks. Module 2A, Heart Attack Description and Causes. The learning outcomes for Module 2A are to explain what a heart attack is and understand the causes of heart attack. Heart attacks in the U.S. Heart attacks are a leading killer of both men and women in the United States. Every year, more than 1 million people in the U.S. have a heart attack, and more than 1/3 of them die. Most who die do so before reaching the hospital. The good news is that the chances of surviving a heart attack are greater if people get immediate medical help. There's very good medical treatment for heart attacks. These treatments can save lives and prevent disabilities. As a community health worker, you play an important role in educating your community about the warning signs of heart attack, the importance of getting immediate medical help, and steps to survive a heart attack. Other names for a heart attack include myocardial infarction, acute myocardial infarction, acute coronary syndrome, coronary thrombosis, and coronary occlusion. These are all medical terms. If a doctor is talking to your client about their heart attack using any of these terms, your client may not know what they're talking about, and you can help by translating it into plain English. You may also want to ask community members, are there any colloquial expressions that people use to refer to heart attacks? In order to understand how a heart attack affects the heart, let's take a moment to review normal heart function. Click on the link on this slide to watch a short video just reminding you about the different parts of the heart and how the heart normally functions. What is a heart attack? A heart attack happens when the blood supply to part of the heart is stopped or dangerously reduced. The part of the heart muscle that does not receive blood or oxygen is damaged, and the damage can be temporary or it can be permanent. The heart is a powerful muscle that pumps blood to all the parts of the body, but the heart itself also needs blood to keep its muscle tissue alive. The heart muscle is supplied with blood, oxygen, and nutrients by the coronary arteries. And you can see on the picture of the heart in this slide, those little blood vessels on the surface of the heart tissue are the coronary arteries. If one of these arteries becomes blocked, the blood can't get to the part of the heart that that particular coronary artery normally supplies, and that part of the heart muscle becomes damaged. That's what a heart attack is. So, what causes a heart attack? Fatty deposits called plaque can build up on the walls of the coronary arteries. And remember, these are the arteries that feed the heart muscle tissue. People who have high levels of bad cholesterol are more likely to have plaque buildup. When plaque builds up on the inside of one or more of the coronary arteries, less blood flow can get through. As you can see in this picture, the plaque buildup on the inside of the blood vessel is making the opening, the passageway that the blood passes through, more narrow. And the plaque can clog an artery slowly, so over time that passageway can get smaller and smaller, or a piece of plaque may break away and cause a blood clot to form around the damaged area. And when an area of damage happens on the edge of the plaque, blood clots around it, and that can happen pretty quickly to cause a blood clot that can completely block that area of the coronary artery. So if a piece of plaque or a blood clot blocks a blood vessel that feeds the heart, it can cause a heart attack. The part of the heart muscle that's not getting any blood supply because that coronary artery is blocked becomes damaged and can even die. And you can see in this picture that there's a clot blocking the blood flow, and the heart muscle that is below that part of the coronary artery that would normally be getting supplied blood and oxygen from that coronary artery is not getting either of those, and the muscle tissue there is dying. And you can see on the left, that's the dark area of tissue, and that causes a heart attack also called a myocardial infarction. If the blood supply to the heart is cut off for more than a few minutes, the cells of the heart muscle begin to die, and the heart rhythm may change or become irregular. As the heart muscle cells die or the heart rhythm changes, the heart may not be able to pump enough blood or any blood at all. The part of the heart that depends on the blocked artery for its blood and oxygen supply is damaged and cannot work right. This lack of blood flow can kill a person or can cause heart damage. The damage may cause a person to become disabled, and the outcome depends on how much of the heart is damaged. The amount of damage depends on how quickly a person gets medical treatment to get the blood flow restored. So now take a moment and click on this link to watch this great overview of what happens during a heart attack, and then close out the YouTube window and come on back to the PowerPoint. Now you can explain what a heart attack is and understand what causes a heart attack. The next mini module is 2B, Heart Attack Risk Factors, Warning Signs, and Prevention.